So in general, that is the way that we diagnose PCOS. So depending on what criteria you're using, there's AIUM criteria and Rotterdam criteria. Basically, you have to have two things to be diagnosed with PCOS. One is irregular cycles. So that is a clinical thing, it's history. Two is either serum evidence of high testosterone. So that means you have a blood test that shows high testosterone, or you have a physical aspect of high testosterone. So that could be hair growth around your chin, like it's called hirsutism. It could be acne. It could be hair loss, male pattern hair loss. So I guess technically you may not need to have blood work, because if you have the androgen symptoms, which are acne, hair loss, hair growth in the wrong places, and irregular cycles, technically that could be the diagnosis of PCOS. So now in today's information society, we'd want to see that there's high serum testosterone, probably a higher free testosterone, a lower bound. We sometimes see LH twice as high as FSH, although that's not a diagnostic criteria. I definitely like to get the labs done around day 19 to 21, but if you're not cycling, you have to go anytime. In addition, for my PCOS patients, we have to make sure you don't have metabolic syndrome. That's where the cardiac problems come in. That would be a high blood pressure, a high triglycerides, an increase in your waist circumference, and a low HDL. Those are the things that would make you have metabolic syndrome. And so you'd have to have a lipid panel. That's a cholesterol analysis. You'd have to have a waist circumference. You'd have to have a blood pressure. Metabolic syndrome, we also like to check a fasting insulin, a hemoglobin A1C, and a sugar. That's what I do. Not necessarily what everybody else does. You might also have been told to get a glucose challenge test where you have a 75-gram drink. It's just like your postpartum glucose challenge if you had gestational diabetes. So 75-gram glucola and then a sugar 1 hour later. So those are the different types of blood testing that we would do.